The leading cause of insulin resistance is obesity. You develop obesity, and subsequent to that, most of the obese kids tend to develop insulin resistance, which is an impairment of the action of insulin, in particularly in the liver and muscle tissues. If you do not correct that, that might be a risk factor for type 2 diabetes. The metabolic abnormalities seen in insulin resistance are dyslipidemia, hyperlipidemia, that means high triglycerides or low HDL cholesterol, and very often we have also disturbances in glucose metabolism, like prediabetes or eventually even type 2 diabetes. Those are the two most common ones. What is the role of the primary care in the prevention of insulin resistance? I think they are going to have an increasing important role in preventing obesity and therefore insulin resistance in kids. Just by monitoring the growth, the weight of the child, they can intervene very early and modify the growth curve of the child and therefore reduce insulin resistance and the associated comorbidities. What are the medications that we are using in pediatrics to treat hyperlipidemia? So most of the first line of intervention obviously is diet, and when diet is not enough, we use some of the statins that are used in adults. The age of onset is very important. We are allowed to start after the age of 10 when the LDL cholesterol is above 170, and we use usually Lipid or pravastatin. Some of the consequences of non-alcoholic steatohepatitis, or called also NASH, are type 2 diabetes, very much associated with it. But even for the liver itself, it's scary because it may lead to cirrhosis of the liver. So that eventually, it's a very serious problem for the liver itself. In terms of metabolism, it leads to type 2 diabetes.